Is the psychiatrist who leads off a video attack on epidemiology and vaccinology correct in saying there is no SARS-CoV-2 virus, no COVID-19 pandemic, no safe vaccine and no need for one? No, that's not true. Neither Dr. Andrew Kaufman, nor any of the other medical professionals who appear in the video with him offer evidence to support their extraordinary claims that COVID-19 does not exist. Kaufman does not explain how in 2020 there have been more than 200,000 unexpected U.S. deaths, attributed to COVID-19. The Johns Hopkins University Coronavirus Research Center put the global COVID-19 death toll at nearly 1.6 million people and the U.S. death toll at 286,117 as of 8:30 p.m. Eastern Time on December 8, 2020. Meanwhile, countries that are both allies and enemies of the U.S. have all identified the same virus and undertaken private and public programs to develop a vaccine against it, several of which have passed their preliminary safety trials, two of them with no serious side effects recorded. Kaufman's claims appeared in the opening minutes of a video on Brand New Tube on December 7, 2020, titled Ask the Experts COVID-19 Vaccine. The caption continued, quote, "Share, download, mirror. With the rollout of the you-know-what just around the corner, we ask a worldwide panel of experts the question on everybody's minds. Ask the Experts produced by Oracle Films." End quote. Users on social media only saw this title, description and thumbnail, quote, "Ask the Experts COVID-19 Vaccine, now banned on YouTube and Facebook. Share, download, mirror. With the rollout of the you-know-what just around the corner, we ask a worldwide panel of experts the question on everybody's minds. Ask the Experts produced by Oracle Films." End quote. On camera, Kaufman, shown below, says the following, quote, "This pandemic is not a real medical pandemic. The COVID-19 vaccine is not proven safe or effective. There is not a clear definition of any new disease for which it can be tested against. Thus there is no target for a vaccine. There has not been a virus that has been purified or shown to be the cause of an illness. Since no additional deaths have occurred in relation to a new disease, there is simply no need for a new vaccine." End quote. What follows on the video is a series of nearly identical claims by doctors, nurses, dentists, chiropractors, naturopaths, a natural nurse and a journalist from the US, Belgium, UK, Ireland, Norway and other European nations. Brand New Tube screenshot taken Tuesday, December 8, 23:45 2020 UTC. In a December 8, 2020, email to Lead Stories, Robert Anderson, chief of the Mortality Statistics branch of the National Center for Health Statistics, said Kaufman ignores solid data, quote, "The statement that no additional deaths have occurred in relation to a new disease is incorrect. Mortality surveillance in the United States during 2020 clearly shows, thus far, more than 250,000 deaths attributed specifically to SARS-CoV-2, COVID-19 and more than 300,000 excess deaths, i.e., more than we would see in a normal year. These data are based on death certificates registered in the 50 states, New York City and the District of Columbia. See https://www.cdc.gov/nchs/nvss/covid-19.htm. Death certificate data for other countries also show large numbers of excess deaths. See https://www.euromomo.eu/graphs-and-maps. End quote. As a board-certified forensic psychiatrist, Kaufman has a medical degree, but he is not certified nor qualified by the multiple years of training required by the relevant specialties, epidemiology, virology, vaccinology and microbiology. Medical ethicists call it drift when doctors try to work beyond the limitations of their specialty. The North Carolina Medical Board, attributing it to the former CEO of the Federation of State Medical Boards, describes the ethical problems of practicing outside your specialty this way, quote, "No physicians in the 21st century are expected to practice, nor are they capable of practicing, all the disciplines of medicine." End quote. Lead Stories reached out to Upstate Medical Center, where online listings say Kaufman practices. The receptionist answering the phone there on the evening of December 8, 2020, could not find Kaufman's name in the physician directory. Lead Stories left a message on the phone number provided for Kaufman on Doximity, a directory of physicians. We will update this article, as appropriate, if Kaufman responds. Taken in order, here are Kaufman's claims. Kaufman, this pandemic is not a real medical pandemic. In a December 8, 2020, email to Lead Stories, Dr. Jeffrey Baird, Interim Chair of Laboratory Medicine and Pathology at the University of Washington School of Medicine, said COVID-19 is clearly caused by a virus. Baird said there's ample evidence of a real medical pandemic. Quote,